A warm welcome to all of you on this webinar today. We from Kinder Hospitals, Bangalore, Whitefield, Bangalore, are hosting a webinar, and it's a pleasure for me to introduce our consultant fertility specialist, senior consultant fertility specialist, Dr. Nidhi Jhawar, who is there with us online. She's going to be talking and explaining us, the most important topic, that is the truth on the IVF and how one has to tackle and how do we, progress further with related to all our questions that we have. Welcome, Dr. Nidhi. I'd like you to introduce yourself to the viewers and let's get to know more about this topic and start moving. We have viewers here and they would be also going ahead with some questions.
Yes,
But
ma'am.
before that, I would like you to welcome and I'd like you to talk about a few words and after that we'll take it further.
Okay, thank you, Shivali, and thank you all the viewers. Sunday evening, they have taken time to be with us. Okay, so today's topic, what we have selected is to talk about IVF, which generally many people they just don't know, and none of the clinics and doctors they will explain. Okay, so I will cover up those topics which are generally not said, and what can be the alternative things. So for this to start, I have to just give a little overview about what is IVF and what is the thing going to happen all this journey. Uh, so let us start with conventional IVF. In during IVF or any fertility treatment, it starts from second or third day or initial of the period of women. Then there will be certain injections. They are said to be hormone injections. It is a generalized name as hormone injection. So those are the hormones which are already there in women's body, called as FSH and LH hormone. Those injections are exactly same as the FSH LH. Synchrony of these injections will make the egg to grow. Now, the amount of hormone injection we are giving to a woman is very important. It decides the success rate of IVF cycle. It shouldn't be more, it shouldn't be less. There should be synchrony between all the hormones. So, this is how we select a protocol, best dosage that depends on the doctor's experience and patient profile also. So once the injections are ready and patient is taking the injection for maybe some 10 days, 12 days, once the eggs are ready, uh, then we will take out the egg with one single needle. That is a small procedure. There is no cut involved, no much surgery involved. That's a small procedure. We call it as oocyte retrieval, where we will take all the eggs with help of single needle, and then after that, we'll our embryologist will shuffle the eggs for the quality of eggs. Based on that, we will do the either IVF and ICSI. Now there are two things. There is one IVF, one ICSI. So many patients will ask this, oh, doctor, are you going to perform ICSI? Are you going to perform IVF? So basically, IVF is mixing of egg with the sperms and leaving it in a dish for natural fertilization. So in natural fertilization, it may fertilize, may not fertilize. So overall, I say with IVF fertilization, it will be less. And there is something called as ICSI. ICSI is intracytoplasmic sperm injection, where single oocyte we will select, single best sperm will select, will fertilize under our guidance. That will give you a better fertilization rate. So now, once the ICSI and IVF, whichever we select, we have done, then we'll wait for 3 days till 5 days for egg to become embryo. Once the embryo is ready, we will freeze the embryo. This is what a 15 days procedure will happen. Now, during this procedure, a woman should be stress free, follow all healthy lifestyle. And then generally patient will ask this question, madam, one very common myth and question, madam, IVF is very painful. So here, if you see, there is only simple injection involved, and here one small procedure is involved. So if you say for pain, I say IVF is completely painless procedure. But still, patient will have this doubt. Every time patient will come, definitely they are going to ask this, madam, IVF is very painful. So this question answer is IVF is not at all painful. Just a simple needle. There is insulin needle through which we give the injections. So that is a very easy, and even patient can take themselves also. That is so easy. Then oocyte procedure retrieval is also completely painless. Then this is what conventional IVF. Now there are certain other IVF modalities also, which we called as natural IVF or mini IVF. In natural IVF, we select the natural oocyte selected by the patient's own body. We'll take out that oocyte, fertilize, and make the embryo. So, and then there is one mini IVF also, which I think 90% of the patients are not aware of. Mini IVF means the dosage of injections will be very, very less. And we'll try to put it some oral medicines also to help increase the eggs. And we generally want some 3 to 4 eggs, 5 eggs in this kind of IVF. Now, if you talk to me, what are the patients? Why don't you do mini IVF for all the patients? Why do you try conventional IVF? What is the need for that? So much injections and all those things. So I say there is certain kind of patient which is suitable for that. Not all are the candidate for mini IVF. Say if we are doing IVF just for male infertility, in case sperm count motility is very very low, but the woman factor is normal. For mini IVF or natural IVF, ovarian reserve should be good. So if that is the criteria, then definitely we can go for mini IVF and give good results also. It's not
Okay.
like mini IVF will be something which is very low and they don't give you. Yeah, of course, in low ovarian reserve or very high PCOS may not be result same, but average women, average ovarian reserve, definitely it will work good.
Yeah, sure. Doctor, this is one most important thing that, most of people don't know is that IVF is a painless procedure, which you told us.
Hmm.
Also, you've explained us the steps in the hormonal injections. Already there are hormones in the body, and, there is a little bit of a boost that has to be done. And that
Yes,
is the reason,
correct.
we take the medications. And the mini IVF is something that people still do not know. So you
Hmm.
mean to say that if the female partner, and if she has good fertile eggs,
Yes,
then if there is a little bit of a deficit from a male partner,
yes,
then advice would be with common or a little lesser drugs that can be used
yes,
hormonally, and then we can go ahead with the IVF. You did talk about PCOS and low reserve. Low
hmm.
reserve, is it connected to AMH? And does is
Yes.
AMH the factor always for you to go ahead with that as a measure? That's
No, no,
another
no.
thing that we should know.
Yes, yes, that is a very big myth. See, most of the patient now these days all are aware. Google and everything they will see. Automatically they will come up with AMH report. Before visiting the doctor, madam, my AMH is very, very low. Ma'am, what to do? Then I say, see, AMH is definitely one of the factor to decide what kind of treatment you need. If
Okay.
AMH is good, we can try for natural cycle. We can try for a few cycles of IUI also. But in
Yeah.
case AMH is very, very low, definitely that is an indication to go straight away for IVF. But the
Yeah.
success rate, the pregnancy rate is not directly related to AMH. There are
Hmm.
certain other factors like your lifestyle, then definitely age. I believe in age more than age. If you are in a right age, if you are not dealing pregnancy very long, still you have a very, very low AMH, success rate will be very good. See, I have one patient, somehow whenever we talk about AMH, there is one patient which I will always give an example. There is this patient, her age was also okay, 32, 33, but very, very low AMH, some 0.3 kind of AMH, which is definitely indication for IVF. She underwent first cycle of IVF somewhere other center. Then that time, two follicles they have grown, but nothing. None of the oocyte could be retrieved. They were empty. Then see, you can imagine if this has happened to a patient, what is her psychology and emotional stress, becoming pregnant, all those things. So then she has come to me, like lot of emotional stress and disturb overall. We spoke to her, given a proper counseling. Like we have a very good counselor at Kinder also. So we counseled her, somehow motivated to undergo one more cycle with her, us. So
Okay.
initial to start with the journey, she was not very optimistic. Again, and for us also, it is very very high risk patient. So to come up with a very good protocol, proper injection dosage, all together counseling throughout the treatment is needed for her. So definitely specific care we have given to the certain patient. Then we retrieve two oocytes and two embryo has been developed. But overall, I say two embryo, you cannot guarantee a pregnancy. But overall, the quality was embryo. Somehow we are able to manage a good quality of two embryos. And while undergoing the procedure also, some of patient become very positive and optimistic, and little bit stress is also gone down. So I say along with this treatment, there is this factor which the low level of stress, just be little optimistic, that will also help. We put those two embryos, this patient delivered full term, not even a many patient naturally also will go to full term, deliver a normal delivery. This patient, she went till full term, delivered a normal healthy baby. So I say it's not just a match. Definitely age is a factor. Definitely your lifestyle is a factor. Stress is a factor. And there are many more factors related to success rate.
Yeah. So AMH is just not the deciding factor for you to go ahead with, IVF is what I understand. Of course, you also have spoken to us on the emotional journey, what it takes for an individual to go through this number of cycles. Maybe first time they go through a cycle and they're really fully not aware about how one has to tackle with, knowing the pros and cons and how do we go today in this topic. Dr. Nidhi, viewers, is talking about mostly related to the truths of the IVF. And truth means emotional baggage,
Yes,
financial conditions.
yes.
What does it take for you to go through the IVF cycle? How Kinder Women's Hospital at Whitefield is going to support you? What are all the things that we do, and how is it a teamwork? So she also specified that we also have a counselor on board. Yes, I agree with her. Moving on to our further questions and our more facts that we need to know, I would like to also tell you all that at the hospital she is available between 9 a.m. to 2:30 p.m. all days, and especially on Sundays for working couples who may not be able to get time out of and want to come. We are very much available over an appointment that can be booked, and we can give free consultation over this discussion to know how do we go about the truths and knowing the facts about IVF and how do we proceed further. One of the most important facts or the truth that Dr. Nidhi people would want to know is that the costs and financial planning. Let's
Yes.
say costs is one part, but let's know about the financial planning. But before knowing about the financial planning, I would like the viewers to know the journey of the period that it takes for a IVF cycle to be completed, from the day that you go through a consultation and then your egg pickup and then the transfer of the embryo, and after that the result awaited, that is beta HCG. So can you tell us what is the planning that one can do during the duration of the time, and how can we plan towards it? Because I'm sure I've seen it's not that it's just a week's planning or 10 days. It takes a
Yeah.
little time for the journey. Yeah.
Yes, 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 correct. Correct. So generally IVF is two type of IVF. One is fresh transfer, wherein within month we'll finish off the transfer. So, but it do not give very good result due to hormonal imbalance. Then there is one frozen embryo transfer where we give first month there will be oocyte pickup and freezing of embryo. Second month, there will be more or less break to the patient. Then third month, the transfer will happen. So you can say to begin with, it will look like a 3 months program. But actually, it needs just 15 days initial and last 15 days during transfer. In between is your time where it is mostly free. So the patient generally they will come up with doctor, I am taking the off, I am not working now, I'm totally concentrating on IVF journey. So I took this long leave. So I always suggest patient, please do not put leave. You have to be working, you have to be doing your routines and completely follow. 3 months you cannot stop your life just for treatment. So please continue with all your works, and it is just a small injections you have to take, and then one day procedure of oocyte retrieval. After transfer, definitely you need to take certain rest that we can tell you later. So as of
Sure.
now, it do not need any bed rest or anything. First thing, then patient can prepare themselves for minimal hospital visit of half an hour and all during oocyte pickup, and one day admission during oocyte pickup. Then FET is a easy procedure, just a 1 day procedure. Certain scans will be there. So that much time it's needed. It's not like a full-fledged you have to give us 3 months of your life.
Sure. So I would say, viewers, it's 90 days of your time, which means 3 months of planning. That means also for working employed people, 3 months of salary and a portion that you can take out from that if you really want to plan your pregnancy and move on further. Having said that, when we always talk about planning, and since I have been associated with the fertility for quite some time, I do get queries when I counsel the patients and all our customers about 3 months. It is not that, when you come for consultation, the very first visit itself, you go ahead with your stimulation or IVF journey, right?
Definitely. Yes.
Yeah. So when you first consult, what's one parameter?
Yes.
And for this 3 months, 90 days period, what's the anticipation or what's the expectation? So I come on a Monday, I visit you, and you would have advised me to come back on a particular day specifically. So how does that work, doctor?
See, generally, first consultation, when patient come, there will be evaluation. Maybe they have
Okay.
to come with, yeah, definitely. First consultation will take some time, maybe 2 to 3 hours it may take. Doing all the investigation, then there will be a little bit of counseling. Even doctor has to understand where do you stand. All those things may take little time. So initial day, but after that, when further reviews, that will be quick. But yeah,
Okay.
until you decide what treatment, certain investigation will give you scans, then semen analysis, all those things, the results will come.
Yeah.
So
Yeah.
once you decide on the treatment parameter, what do you want to undergo? Maybe IVF is not always IVF. There is natural cycle. There is IUI also. So
Yeah.
based on
Yeah.
that, yeah, you need to take a call. But yeah, generally half an hour in the hospital is enough during follow-up visits. Initial visit
Okay.
may take some time, so prepare for that. At least 2 to 3 hours, you should have it in your hand.
Sure. So I would say that, when you come for the first consultation, as everybody here are anticipating what more can we know about it. The very first consultation, when you come with us, we have a first consultation which is complimentary. And you also, with this, we have a benefit of up to 30,000 worth, offers that we are giving for the whole of 90 days journey. Along with that, when planning has to happen, we also have free EMIs and safe options for you to save some money along with us, and then we can take it further. So 90 days, 3 months, viewers, is a very good time. But before that, I'd like to tell you all that let's plan ourselves, spend some time. As Madam says, Dr. Nidhi says, that the initial stage is going to be history taking, and there will be a little bit more of information that has to be taken for us to plan a personalized care for you. And post that, we will also be able to know how we have to take things further. Dr. Nidhi, along with this, while I'm actually talking about finances and costs, is it that the patient has to make the payment at one go at the during the IVF, or
Absolutely
is it
not.
going to be
No.
you do have certain breakups and you can plan yourself better?
See, yeah, there is always a part payment for that. One go, we need only till oocyte pickup and injection cost. That's all.
Okay.
Then after that, there is a transfer cycle. So where
Okay.
different cost will be there. But yeah, there is always a slab of cost which can be worked out at the center based on patient affordability and how do they want to go ahead. Hospital is very open for cost things, and they are taking it not see, it's not just a cost, it's the results also that matters. More than two hospital cost is a one factor, but yeah, we want to give you best results also. So based on that, they are ready to adjust with any kind of cost differentiation and all those things. So generally, we talk to patient based on their thing. We will give them the slabs, and so accordingly they can make the payment.
Sure. So, there is no need. There is no need for you to wait for long hours. Waiting time is very, very minimal when consultation happens, because all the consultation are appointment based, and we are flexible to move the appointment if there is a delay, or keep it early if there is a requirement, and we can always plan that across. And we know now that the costing is not one go that you have to spend. It does take 2 or 3 intervals for us to go ahead with the costing as well. And another question that I have, we will be open for the Q&As a little later. This is a part of the truths that one must know, is that what clinics don't always say. What is it that they don't talk about IVF? How do they treat this?
See, generally a clinic, 90% of the clinic, they just follow the same protocol that will be given to the doctor that they have to follow, or doctor will have, will make the certain protocol, and to all the patients they will use the certain. But as per me, what I have seen is, being 15 years in my practice, same protocol do not work for all the patients. This has to be individualized based on patient parameters. That will work better than, rather than getting the same protocols. So one thing is to choose the right dose and give you the right medication will definitely work, and individualizing the protocol definitely works. Then definitely you can try mini IVF. As I spoke, I have tried for many patients and they have beautifully conceived and delivered also. So
Okay.
this definitely works for a patient who fits into this criteria. So these are
Okay.
the things which I really wanted to talk, which is something different that generally no one talks about it. But yeah,
Okay.
definitely it depends on patient to patient factor.
Okay. So I am getting in some question and answers. I will take it in between, as people would want to know. One
Hmm.
of our viewers wants to know that her age is 28
Hmm.
and married since 3 years.
Hmm.
And should she go with natural cycle IVF or mini IVF?
Uh, to question just with, see, I say age is very appropriate to go for mini IVF, but not just the age. Both of their ages are okay. But first of all, I wanted to know, why do you want to go for IVF during this age? Okay.
Okay.
Let us try some natural cycle, or maybe IUI can work for you. But in case you have underwent certain investigation which suggest IVF, I would really like to know what is the investigation so that I can suggest better for you. So if
Okay.
possible, just do visit center once.
Yeah. So Dr. Nidhi says that the age is very appropriate, viewers, and it also takes you to just come down to the consultation once, which is complimentary, and have a discussion. It would require a few more, understanding about you, as she specified earlier that we do give personalized care and a treatment which is also personalized. Again, I would like to say treatment which is personalized, individual treatment, patient to patient, customer to customer, to know how we can deal with each individual. Having said that, I will also want to talk about the few things that we have just discussed now. Uh, there is a myth that you have to go ahead with IVF completely. No, there are alternative options. A mini IVF, age appropriate, basis on that, and if the parameters of a female is better, much more better than the male parameters, then definitely we can consider medications lesser. The third thing is, how do we do it? We do a personalized care, and we know that the IVF journey is just not a week's process or a 10 days process. So it's a 90 days process. So we know we do have good timing for us to plan ourselves and move on further. And Dr. Nidhi Jhawar has given us good insights about a new topic which I myself did not know, a mini IVF. Thank you for that. Moving on, we also know that AMH is not the only factor. Yes, a very important factor, but not the only factor for you to decide how to or whether to go ahead with IVF or not. There are options that can be chosen basis on the IVF and basis on multiple other parameters as well. Again, Kinder Women's Hospital at Whitefield, located in the IT hub at Bangalore, offers up to 30,000 benefits which are going to be utilized, and we are very very flexible with related to timings. We want couples to come together, discuss about their options, and emotional quotient or aspect is also again very important. As we heard from her, we need to know about how do we tackle that as well. I will go ahead with question and answers in a while. The other thing that we have to move on is the what does one know about the medications that has to be taken. Medications is just not same for everyone. That has also got to know about it right now. Dr. Nidhi has over 15 years of experience in the industry, and she is a reproductive medicine specialist serving at Kinder Women's Hospital and Fertility Center as a dedicated doctor who supports and assists the patients as a team. So we have a team of the IVF specialist, or I would say fertility specialist, which is more important. We have the embryologist, a senior embryologist who decides and discusses with the doctor very closely. A counselor who counsels you, understands the parameters, and moves on further. With a whole team support staff who's going to help you through and through with this journey. Now I am going to open up for further Q&As. I have another viewer who's asking a question. He says, my wife is 31 and I'm 36. She has PCOS and endometriosis for the past 5 years. Does that mean she'll need more injections, doctor?
See, PCOS generally do not need more injections. Injection doses will be less in case of PCOS. The patient with low ovarian reserve generally need more injection to develop same amount of eggs. But yeah, definitely, if your wife is PCOS, then the injections will be less based on endometriosis also. How bad is the endometriosis? We have to decide.
Okay, so endometriosis and PCOS both are directly not interlinked. They're
Yeah,
not
both are
connected.
directly. Yeah, see, endometriosis, it may cause little bit of oocyte quality, which will reduce because of that. But yeah, that depends. See, small endometriosis and all will not make difference. But it is definitely, if it is a big endometrioma or the multiple endometriosis, it is going to make difference. So it's based on the evaluation. We have to evaluate a little further, and then based on that, we have to decide.
Okay, so the answer currently over this quick webinar is going to be that you don't need more injections, even if you're a PCOS or you have endometriosis. Endometriosis has to be dealt first, and then we know how do we go ahead with the plan further if it is severe. Otherwise, it may not hinder much in our protocol of the IVF cycle that has to be going through. Yeah.
Yes, yes,
Thank
correct.
you. Thank you, doctor. I'll move on to the next. There is another viewer. He says, hi, doctor. I'm 42 and my wife is 38. We have already gone through two failed IVF
Hmm.
cycles. How
Hmm.
would Kinder IVF be different for us? We're
Hmm.
both nervous about trying again.
Mm. See, sir, first of all, your age is okay, 38. I understand this, but I would like to know the little details why the two times it has been failed. Based on that, those details, we have to come up with a protocol specific for you to give you best results. But yeah, definitely that insight is needed, what has happened during those two cycles. So if you can provide us those details, it will be easier for us. And definitely Kinder can help you with the protocols are very good, and the success rate, if I say, it goes 80%, 70 to 80%. Out of, if we are transferring 10 patients, then at least 7 to 8 definitely is going to come positive for us, because the lab is following the standard protocols and maintaining all the high standard. And we are personally helping with each and say the sperm count is not good. If it is a sperm deficiency, if it is a egg deficiency, we are using the specific kind of treatment for that. So definitely it is going to help you. But yeah, I really need to see you once.
Sure. For booking appointments, again, viewers, please contact us on the mobile numbers which are available on the website and in this webinar where the information has been shared. Doctor is available all 7 days, especially Monday to Saturday, available between 9 a.m. to 2 p.m. and on Sundays on appointment basis, we definitely will be able to spend time to you and understand more about you. And if you're visiting us for the first time, it definitely requires some time that you have to keep with you undivided, so that we discuss about your plans and then take the things further. Thank you, ma'am. I will move on further. Low testosterone is affecting the male fertility a lot these days, even in early 30s. Would you agree? Is the question.
See, generally, what we see patients, it does not come as low testosterone. There is some genetic involved with during 30 years. If you are having low testosterone, there is a little more further evaluation is needed why it is low. Then there is some genetics also involved. Then, along with genetics, I think I have not spoken about much about lifestyle in this full session. So, I would really like to speak about it. The lifestyle of the person, especially males. Yeah, even females, PCOS is directly related to lifestyle, but males also. There is this myth that women has to follow certain lifestyle, but it is a couple treatment, and the baby is
Yeah.
both of yours. So that goes for both. Lifestyle needed to be followed for men also. So, healthy lifestyle includes proper exercising, high protein diet, avoiding junk, taking proper water. And then, specifically in case of male, I say not wearing very tight clothes, not be following sedentary lifestyle, because half of the people they will just sit on laptops and they will follow sedentary life. And then, secondly, not getting exposed to high temperatures. That may be one of the cause of testicular failure, not producing proper sperms. So if you change this, it is going to help you to certain extent. Till what extent we will come to know. With the slow changes, you will definitely it will become better. But yeah, low testosterone definitely needed little more evaluation. Maybe pituitary is not functioning well, or it is at the local testicular area. We need to see that. So it's
Sure.
not like everyone is getting affected by it, but your lifestyle changes definitely helps.
Sure. Yeah. Thank you, doctor. So I would say that, viewers, we will also have another topic that we would be discussing about lifestyle specifically, because we're getting quite a lot of information basis on that, or questions or queries before basis on that. I will move on to the next question. We both are less than 30 years and have been trying for more than 3 years now. We want to know, can lifestyle changes actually improve our chances of success naturally, or is it time to meet the doctor? Again, doctor, like I said, we have another lifestyle related question. I think both of us have to take this, probably in our next session. But over to you, ma'am.
Okay. I'll just talk little about it. More or less, I have spoken about lifestyle. See, now I'll talk only about this scenario. Both are less than 30 years, say. Okay, high time of fertility, I say 30, less than 30 years. Then it is not just your fertility is definitely related to lifestyle, but since the childhood till now, what lifestyle you have followed. If you change your lifestyle, definitely it is going to help you to a certain extent, but it is not going to make any magic altogether. Okay. So if you have a fertility which is okay, average fertility or good fertility, then definitely it is going to help you. But say if you are a very poor ovarian reserve at this age itself, then it may not help you. So it based on totally your evaluation. But yeah, definitely it is low ovarian reserve, it is high ovarian reserve, whichever lifestyle changes will definitely help you. Okay, but just to sit with that, I suggest both the treatment and lifestyle changes constantly you have to do. You cannot just sit for that and keep waiting. So get a simple evaluation. Do not go for advanced evaluation. Maybe you can visit one. Will have one certain basic test to look for your fertility. If fertility is good, then maybe you can try for certain months and see.
Sure. Right. So it does, answer to the query. I'll move on to the next. Hi, loving the session. Thank you so much, ma'am. So we are also very motivated when somebody says that, you like the session. My AMH levels are low. Does it automatically mean I need to go for a donor egg cycle, or are there still options to try with my own eggs?
Okay, so this answer I will tell AMH, as I told you, it's not just the criteria. If in scan, I have given example of this patient also where very low AMH results, we have given good pregnancy. Definitely, your age is important. If we can see certain eggs in a scan, that is also important. A match, generally, what happens, Shivali? A match, if you do it from a good quality lab, it will give you best results. Otherwise, there is no standardization. Randomly, if you do, that results also we cannot trust totally. Okay. So,
Sure.
it not necessary. I say it is not necessary for you to go for directly for the donor. Definitely, you should try for your own eggs if it is not very, very low. So I say zero point zero 0.00 something. Unless that is the condition, if you are going into premature ovarian failure, that's a different thing. Otherwise, definitely you should try with your own eggs at least one cycle of IVF.
Sure, sure. Thank you, ma'am. We have some more questions pouring in as we are, going ahead with this session. I would like to, in the meantime, inform you all that again, Kinder Women's Hospital is available for all your queries, Q and A's, all the details that we have to answer. We are still live. We will go ahead with some more information that is going to come up. Hold on to the next question. The next question would be, how would be the success rate of IVF? As I hear from many people on failed IVF, what's the best age limit to go through IVF for men and women?
To age limit, I'll answer there is no age limit. Age limit in the sense if you are more than 35 plus, definitely you can opt for, but if it again depends on ovarian reserve and your sperm parameter. Say if you are coming around 34, 35, but I could see the parameters are okay, still we can try to give you natural pregnancies. There is no indication as such ki directly you have to. But yes, if you are 38, if you are even 38, I have given natural pregnancy then with IUI. But 40
Okay,
years plus is become little difficult. If you
sure.
are 40 years plus, then definitely I say do not waste your time. Just directly go for IVF, get a healthy baby, and that can be done best. But if you are around 35 and all, then based on your parameters, if say ovarian reserves looks okay, semen parameter looks okay, other overall health issue, again this thyroid and endocrinological issues, then diabetes, all those things affect fertility. So these also need to be taken into consideration. So looking at all the
Okay.
parameter, we can come up with a best plan, what kind of treatment you need. So
Okay. Sure. Yes, like again, lifestyle parameters and the age. Age does matter, like doctor said. There is no age limit, but does the age matter? Yes, it does matter. And how many years of married life also matters. And I would say, viewers today, in the field of fertility, it is not always about IVF. That's why we are here to talk about the truth of IVF. We support you on your fertility journey. On an average, 1 is to 6 couple or 1 is to 6 individual would require fertility treatment, which means you don't have to go through the IVF journey, but you have to consult your fertility specialist before preconception or soon after marriage to plan your pregnancy better, to understand how do you have to go. Is PCOS already in the family? Do you have concerns? And will that help you consulting a doctor? Consulting a doctor, Dr. Nidhi Jhawar, does not mean that you're going to go through straight IVF. She has emphasized on the fact that, 38 years old female who did come to her also did have IUI, which was done as a fertility treatment. And through that, the couple was positive as well. So I would like to again bring upon light here is that one does not need to go through IVF cycle. One does not need to go through that journey before consulting your doctor, your specialist, fertility specialist. It means you need to come over, have a discussion, get to know more about the services that can be offered and the various protocols and individualized plans that can be created. It could be IUI. Sometimes it could also be that you don't have to, conceive through any options, but for coming and understanding this and going back, knowing what you should do and how your cycle is, your natural cycle is. You also can go through mini IVF, which means you don't have to go through a lot of hormonal injections while your age, while your AMH and other parameters are good. Moving on, we have one more a viewer who wants to know that my age is 34. I have endometriosis, adenomyosis, high prolactinemia. I had 2 IUI failures. My AMH is 1.5. My first IVF turned out to be biochemical pregnancy. Now planning for second IVF. Any treatment options, doctor?
See, I would like to know how about endometriosis? Have it dealt with already, or still it is there? Endometriosis definitely have detrimental effect on receptivity plus oocyte quality because it releases lot of chemicals which is toxic to the body. So the changes in oocyte and receptivity will be there. So if it is already there, otherwise I suggest deal with endometriosis first, then go for pickup and then transfer. Go with a stepwise procedure because already it's a one cycle fail. Then the reason, secondly, reason of one cycle fail. What quality of embryo was implanted? Were they poor quality? So automatically they are supposed to become either way. Sometimes what happens if you implant very poor quality, they may implant, but they will end up becoming biochemical or they will end up becoming abortion further. So these kind of embryo generally do not give results. So what kind of embryo has been implanted? But yeah, definitely deal with endometriosis, go for pickup, and then go for transfer. That is the better plan of action.
Sure. So it also means, viewers, that while we were talking about it earlier, if you look at 10 IVF pregnancy, or if you look at 10 cycles, let's say, it means that the success ratio with Kinder Women's Hospital and Fertility Center is around 70 to 80%. So I would say 7 couples out of 10 or 8 couples out of 10, with the kind of quality and treatments that we are maintaining in protocols, we do have good success rate. Recommended option is going to be consult your doctor with all your information in the past. You would have consulted an obstetrician and gynecologist in the past, but that requires a little bit more information through a fertility specialist who would be able to view and understand and get to know the history a little bit more better. And basis on that, we could give you an option to go ahead when you're planning for your second IVF or after IUI. And if it did not work, for that, when you have to conceive through IVF, or if you have to deal with endometriosis, there are multiple options, all are available. And one of the most important things that I would like to tell you is, we here are today to assist you on all the issues that you would face. However, it is better that we consult over a one on one. We do have a mobile number which can be accessible for you all to contact us to book an appointment. And the number, I would like you to make a note of it, is 8618999833. Please contact us, book an appointment with your consultant, fertility specialist, Dr. Nidhi Jhawar. She will be assisting you and helping you more personalized. Moving on for the next question, doctor. Again, hi, doctor. My wife has having PCOS issues. May I know it will affect pregnancy and why is it arising?
Little bit I'll talk about PCOS also now since this
Yeah,
question has come.
yeah.
PCOS, chances of conception, it may take little bit of assistance because generally what happens during PCOS, if PCOS very very severe or moderate severity also, ovulation will not be there. Women generally will have irregular periods, irregular in the sense delayed period generally, maybe 1.5 months or 40 days, 35 days like that. So getting period do not mean that you are ovulating. That one myth, doctor, I'm getting period every month, so my ovulation will be, they'll come with 14 days proper. Doctor, we have had contact during 14 days, still it hasn't worked. So I always tell them, maybe you are getting your period on time, maybe you are having a delay cycle or whichever kind of cycle. That doesn't mean that you are ovulating. Ovulation need to be confirmed. Egg is alive only for 24 hours. Within that, you should have contact to have the pregnancy. So now here in PCOS, generally ovulation will not be there. What bleeding you have is breakthrough bleeding because of hormones, and minimal of hormonal imbalance will be there. So the kind of PCOS need little bit of assistance to get the egg and ovulation. So maybe natural or IUI can work for you. You don't have to
Okay.
jump directly to IVF if your age is appropriate and PCOS is not like extremely bad.
Okay. Okay. Great. Thank you, doctor. We have to wind up the session in another minute or two. In the meantime, I would like to tell the viewers that there is a link description below where you can click and book an appointment with Dr. Nidhi Jhawar, and the benefits worth of 30,000 that you could be availing. Already, I would like to say, viewers, that there are 3 appointments that are booked for her, and all of them would be availing the offers if required for fertility treatment and IVF cycles that has to go through. Again, yet, I would like you to inform you all that we are available for any appointments that can be booked Monday to Saturday. Please connect with us through the link description below, and it would be helpful for you all when you come over, have a discussion one-on-one with the doctor, and meet the team, understand more about how can we treat PCOS. Is there a possibility? What is the AMH parameter? If I have gone through IUI multiple number of times, or if I have gone through IVF one or two number of times, is there a chance for you to conceive? My viewers, the answer is yes. It is possible, depending on the parameters one goes through. Every individual is different from one another, and we treat every individual with their own requirements, and basis on that, a clinical team sits down and discusses and plans the options that has to be offered. However, having said that, I would like to actually thank Dr. Nidhi Jhawar for giving us time on a Sunday, especially at this hour of the day, and answering most of our questions. All the other questions that are there will be answered by us very shortly. Kindly go through the descriptions and get to the link where you can book the appointments. We will be helping you. We are looking forward for a one-on-one meeting with most of you, while you would be interested in going ahead with those options. Benefits that are available worth of 30,000 rupees, I would like you to please avail it. I have one last question, which I do not want to miss, and after that, we will be winding up the session as well. My wife age is 46 and my age is 53. Should I go for IVF? We are married since about 20 plus years, and the AMH is very poor, and the scan has no egg visibility for my wife. So, this is something that I would like you to
Okay.
answer,
Yeah,
doctor.
yeah, definitely. And there are certain more questions which I'm very tempted to answer, but since the
Yeah,
time restrictions are there, but yeah, this one
absolutely.
definitely. See, to this is specific to the person who has asked the question. Okay. Now age is there, but I have given results in age of 46 and 47 to women's age, not the men's age. So
Okay.
if that patient becomes pregnant and delivers a healthy baby, then definitely you can, sir. So I would definitely like to see you, meet you in person, see the history, a little bit of evaluation. Then definitely we can help you with that. So I say definitely you should visit the hospital, and I will be very delighted to take your case and give you the success rate. And I think one more question is there. They are asking for success rate at Kinder Hospital. So I suggest it is almost 80% of success rate what we are giving with our IVF or any kind of fertility treatment. Yeah, definitely 80% with IVF. We are giving the results and based
That's
on
right.
patient parameter.
That's right. Currently, Kinder Women's Hospital is located at the heart of Bangalore city at Whitefield. There is a description link that is given for you all to book the appointments. And as I said, we do have availability, and we do custom make it for whatever reasons. If viewers are not able to connect with over a one-on-one personal meet, we are also open for a video consultation for the first time. To know more, you can always book an appointment through a video consultation, and we will support you and help you. That means anybody from any part of the city or any part of any other place, we would be more than happy to advise you, explain you the details, and go through the procedure step by step. We have to wind up now, and I would be looking forward for the next session. That's going to be a topic that we will pick up from the most frequently asked queries from this topic today. And I'd like to thank Dr. Nidhi Jhawar for being a part of this webinar, and let's answer to more and more queries that are going to be there offline, as we have to go offline now. I would like to thank all the viewers on behalf of Kinder Women's Hospital and Fertility Center. Please book an appointment, avail all the benefits. First, think about it, plan yourself, come to meet the doctor, discuss with the doctor, and then you would be able to decide how to go about with your treatment plan. And there is no rush, or there is nothing that you have to think or wait. But I would like to say, married couple, post a year and a half, it is ideal to go through understanding options of conception. How can we go ahead and treat fertility, not only with IVF, but also with other fertility treatments that are available? We would be more than happy to help you as a team. The team works fantastically. We are a state of art fertility center situated at Whitefield. Connect with us, and we will be able to help you. Thank you, Dr. Nidhi.
Okay,
We
thank
will
you.
catch up
Just
very
a
soon.
little bit from my side also. See, I would
Yeah,
like to thank all the our participants definitely, and I'm very much tempted to answer all the questions and to see them in person
sure.
because I wanted to give as many results as possible. That is what the
Yes,
most happy
yes,
thing you feel once the patient get the results. And then I would like to say a little bit that here at Kenda, we are available to support you with throughout the journey. It's not just the treatment perspective; it is your
yes.
emotional because this treatment overall it is draining, emotionally draining also. So with your emotions, with your finances, definitely hospital will take care of that also. So you're very open for any kind of help from our side. So please do visit and let us meet once.
Absolutely. Thank you so much, Doctor. Thank
Okay,
you, all
thank you.
viewers. See you soon when you need us. We are there to help you and support you. Signing
Okay.
off. Thank
Oh,
you.
bye bye.